The Ministry of Health has cautioned the public in regard to health workers who may ask for bribes in order to vaccinate the public. And according to the Ministry of Health, the vaccination is free of charge
to eligible persons once the vial has been opened. To the general population, COVID-19 vaccination is voluntary and free of charge. Please go for this vaccine when your turn comes. Most importantly, report any individuals who solicit money to administer the vaccine. This is a criminal offense, and the responsible officers will be apprehended and punished according to the law.
The minister also encouraged the public that there is a plan set towards the side effects of the vaccine, and they have dispatched health practitioners countrywide that are responsible for that.
You are advised you can take some painkillers and you go home and rest. They usually wear off within 1 to 2 days. If there are any adverse events, they are investigated immediately. And the investigations may include admission and follow-up. In the event that anyone passes away after vaccination, we still investigate because we want to see if the death is related to the vaccine. Many of you are aware that people die, and people will continue to die, not necessarily because of the vaccine, but because of many other causes of death.
The minister also stressed that as of now, there are no deaths related to the vaccine registered.
Due to a heart attack, we will still investigate you and carry out a post-mortem. And until we establish the cause of death, then we release the information and drop you from our statistics. To date, we have had no deaths. To date, we have had no reported history of any blood clots. But we have had minor side effects.
The World Health Organization country representative has urged the public towards the dosage of the vaccine from India, that since India's concern now is the internal vaccination, he assured the public that though there is likely delay of the vaccine in the country, they will be able to receive their dosage to the fullest.
And but compared to the in prioritization, because they have certain level of immunity, they can delay taking their vaccine for at least 6 months. It's not that we are saying they shouldn't take it, but they should give priority to other people to take it. Still, the scientific evidence is showing that they are still better protected if they receive the vaccine.
He further commented on the blood clots cases which are related to the AstraZeneca vaccination and other side effects.
Of dying from clotting disease than when they are vaccinated. So that is another important evidence. And in any vaccine, we always have a very small risk. And this risk with AstraZeneca is not far different from what we see in other vaccines for us to recommend for the vaccine not to be used. And I think it's an important message that the AstraZeneca vaccine is still safe.
Lieutenant Colonel Dr. Henry Chobe also commented on the new variant in the country.
These, obviously, each one of them have the general tendency of the mutants or variants is usually to may increase transmission and increase virulence, and also we may have what we call immune escape, where sometimes, and we do not have evidence yet, that sometimes they may evade the vaccines, but we don't have evidence to this yet.
As of today, 144,000 persons have been vaccinated against COVID-19 in the country. And by 6th of April, Uganda had registered only 16 new cases, which put the total of cases to 41,062 people, although the number of active cases remains 24. This story has been compiled by Issa Chigongo for Channel 44 Prime News.